Hello, everyone. We're going to get started now. So thanks for joining today. I'm Dr. Laura Stuve, and I will introduce myself in a moment, but this is the first offering in our series that we're starting that will be offered monthly for everyone to discover the magic of mind-body medicine. And there's different types of mind-body medicine. I'll talk about that in a moment. But our topic today is a very important topic because we all want a healthy and happy brain. So we're going to talk about what happens when our brain functions get foggy. So the intent of the series, as I just said, I want to share different vignettes on different healthcare topics that are going to take you a little bit into the science and show you some case studies that are compelling to really elaborate how mind-body medicine can solve and resolve very complex chronic health issues. And today, instead of sharing one case study, I'm going to share my analysis of 34 people that did have post-COVID impacts. Most of them had brain fog, and it's a really beautiful illustration of the efficacy of this system. But I want you also to all see what mind-body medicine, what does a treatment look like in action? I have a 100% telemedicine practice. So unless you actually show up at my house, which very few people do other than family and friends, I work at a distance. So that means I can demonstrate in these virtual forums what a treatment looks like. And we have two wonderful women that are lined up for our demo today. All righty. And again, if you guys could put all your chats in Q&A, then I'll get to any questions later. So many of you know me and some of you do not. I'm just going to pause and tell you a little bit about me. I am a PhD molecular biologist, which means I understand cells and the things inside cells. That's what my training is in. It's in human genetics and epigenetics. And I came from a research background, having spent 26 years doing basic science in the area of human genetics. I have worked in mind-body medicine for 19 years now, since 2005. I started out in the body talk system of mind-body medicine. There I met Dr. Janet Gallipo. We were both senior instructors in that system, and we have gone on to create kind of the daughter of Body Talk, which is Body Intuitive. And we combined our areas of expertise. She's a doctor of Oriental medicine, so she brings the ancient healing wisdom of the East, and I bring in the latest scientific insights from the West into this very academic system. So I have literally a pile of charts that I use in my sessions. You're going to see me referring to those when I do demos today. This is a system of precision medical intuition. So we observe things with our medical intuition, and then we also observe how to resolve them. And we activate what we call a healing roadmap to facilitate the body's healing superpowers and engage them. My general approach the whole time I have been in mind-body medicine has been with my science brain. I like to dive into different areas of science that are relevant to human health, study all the latest research that is coming out, develop ways to use this in a healthcare setting. So science-based healthcare tools. And then I work with them with my clients until they're working well. Then I train them to other healthcare practitioners, science up their understanding so that they can support others with health issues. I have done this first working in Body Talk with Dr. John Veldheim, the founder of that system, in bringing in all the science on the human microbiome and its impacts on our immune function. The immune system has been a fascination for me for many years, and we're going to be talking about the immune system today. If you want to connect with me, I'll give you this again at the end. This is my email, laura@mindbodyscience.com. That's where you got your welcome to the webinar reminder today. Okay, so let's dive in. What's mind-body medicine? There are a whole host of modalities that are under this larger term, mind-body medicine, but basically it means any modality that is using the 21st century understanding from science on how the mind and body are connected. Obviously, this is not just an understanding from science. Spiritual disciplines and healing traditions have been using this understanding for millennia, and science is now catching up with that. But basically, our emotions, our mindsets, our belief systems, how we hold our stress can impact our body's health. So our mind impacts our body. And when our body is out of balance, it can impact our mind. And this is actually the piece of the puzzle we're going to be looking at today. How imbalances in the body impact our emotions and our brain function and our cognitive capabilities. Okay, so the first chapter today is to learn a little bit about the science of what causes brain fog. So brain fog, this is a term that we all hear a lot. It is a common issue many people have. It's when our brain doesn't work as it should. And so this idea of a foggy brain means that we cannot concentrate well. We have a very short attention span. We can't focus long enough to do whatever it was we set out to do. We can't remember things. It's hard to learn. We can be confused. Our language is impaired, sometimes in speaking, sometimes in finding the right word. Our thinking is slower sometimes, or your brain just kind of runs out of energy quickly, like it works and works, and then all of a sudden it stops working. And then there's a whole host of emotional and psychiatric symptoms that can be woven in with any of these other issues. Some people just have impairment in one of these. Some people have everything on the list here. Everyone has a slightly different spectrum of symptomology in their brain fog, and that's important. That tells us what areas of the brain are inflamed. So what causes brain fog? What does the science say? With head impacts from things that are very serious, traumatic brain injuries, even minor concussions. So any car accident or bicycle accident or sporting accident that you've been in where you've had a head impact, there can be a signature of that in your immune cells in your brain today. The big brain fog kind of culprit today is COVID-19. This virus triggers inflammation in the body and the brain, but it's not the only virus or infection that causes brain fog. Other infections do as well. Toxins and medications, so chemotherapy, medications. Um, Many women complain at different times in their life of their brain doesn't work the way it normally does. So sometimes people call that pregnancy brain or menopause brain, or, once a month with your cycle, your brain is a little different. Your emotions are a little different. Even with all of these things that we might experience in life, early trauma in our lives predisposes us for brain fog should we happen to have one of these triggers later on. And if we look underneath all of these, they elevate inflammation in the brain. So we're going to learn a little bit more about that. But first, we're going to understand the COVID piece of the puzzle, since it is so very common today. So the virus that causes COVID-19, the SARS-CoV-2 virus, we know one of its, and especially the earlier strains, although the strains today still do this, they can impact your sense of taste and smell. That's because they directly, in fact, infect the olfactory neurons in your nasal passages that are just a very short distance away from the brain. Then the virus can hop over and directly impact your neurons, infect them. Okay. When this happens, the immune system in the brain needs to resolve that. The other thing is that the COVID virus is a hyperinflammatory virus. So out of all the viruses that have been studied, they all cause inflammation, but COVID is extreme in this regard. And when you have a lot of high inflammation at the sites of infection and post-infection, maybe in your lungs, maybe in your digestive tract, maybe in your kidneys or your liver or your heart, that body inflammation also talks to the inflammation, the inflammers in the brain, and elevates your brain inflammation and your chance of ending up with COVID brain. So by direct infection and body inflammation, this virus causes the cognitive impairment of COVID brain or brain fog. And this has been extremely well studied in the past 3 or 4 years. And at this point, there are some large studies of hundreds of thousands of people, in some cases, millions of people. So in very strong statistical significance. So I'm just going to highlight some of the research findings on what COVID does to your brain. Both a mild infection that gives you cold symptoms, a moderate infection that gives you flu-like symptoms, or severe COVID causes structural changes in your brain, shrinkage in your higher cognitive centers. Shrinkage in the brain, never good. Basically, the scientists that have looked at this in functional MRI assessments feel like every case of COVID, mild to severe, ages your brain by 7 years. Okay. No one wants a brain that gets older. If you get COVID annually, then instead of your brain aging 1 year, it's aging 8 years every year. Never good. It breaks down the very critical barrier that separates the brain from the rest of the body, the blood-brain barrier. And there are risks that are elevated for as far out as the studies have gone, which is 2 or more years. Cognitive issues, increased risk of dementia, doubling your risk of Alzheimer's disease, seizures, epilepsy, and psychotic and emotional symptoms. Okay. So let's talk more generally about inflammation and inflammation in the brain which is neuroinflammation, or I refer to this as brain flames. All right, so what do we all need to know about inflammation and brain flames? The immune system, including the immune system in the brain, is all about balance. What do I mean? There's two sets of cells in the immune system: warrior cells that fight off infections and use inflammation defenses, and peacekeeper cells that rein in the warriors with their anti-inflammatory cytokines. They keep the flames low. If there's inflammation in your body, if you've got an area of chronic pain, if you've got brain fog, that balance has been lost. Okay, so when the balance is lost, you end up with inflammation. Just as we just spoke about, if a COVID infection age accelerates your brain 7 years, inflammation also age accelerates your body. So there's a field called inflammaging, which identifies that one of the main mechanisms of cellular aging, brain aging, body aging is inflammation that ticks up over time. Why does this happen? Things that we live through and things that we inherit from our parents, grandparents, and great-grandparents basically can keep the body kind of stuck in elevated inflammation patterns. Okay? And as you accumulate more levels of stuck inflammation, kind of locked in at the code on top of the DNA code, the epigenetic code, then you accumulate a few more aches and pains with every year. It's harder and harder to remember things. Maybe you end up with a full autoimmune disease or allergies or chronic pain or brain fog. And if we're looking at lifestyle factors that elevate and lock in higher levels of inflammation in both the body and the brain, the two primary lifestyle factors that do that today are stress and COVID. So stress, every stress you live through, both the little daily stresses and the bigger stresses, kind of locks your body in higher and higher inflammation. So inflammation is on a kind of an upswell as you get older. COVID does the same. Even asymptomatic COVID and mild COVID can, behind the scenes, start to ratchet up the inflammation in your body and in your brain. As I said, this is one of the most highly inflammatory viruses ever kind of studied. And even after the COVID infection is completely resolved, the body and the brain can have high inflammation that just got locked in, which means your immune cells are more inflammatory than they were before you had the virus. And if you get COVID every year, since there's a slightly new variant, just like the flu, again, your inflammation is going to tick up in the background and eventually start manifesting as symptoms. So the next thing we need to know about inflammation is that the inflammation from here down in your body is connected to the inflammation from here up, the inflammation in the brain. So even if nothing is happening in the brain, if your body gets super inflamed, your brain inflammation will also go up. Why is this? There are two cells here that are connected. They share a lot of roots in terms of our developmental history. They come from the same mother cell very early in human embryogenesis, and then they split. One of them lives in the body and one of them lives in the brain, but they remain connected. And it's the connection between the macrophage. This is an actual photo of a macrophage in the body and in the brain. It's the macrophage's sister, the microglia. And this is a photograph of a microglia. Because these cells are connected, when the macrophage inflame, the microglia inflame. Okay. And there are also macrophage in the head that we will meet in a moment. So when there is inflammation in the brain, what cells inflame? Primarily, it is the only immune cell type that is in the brain, and that is the microglia, the cell that we just met, the macrophage's sister. So in the absence of some sort of injury or infection, the microglia perform an essential role in their rest and repair. They're what are called the gardeners of the human connectome. So the connectome are the fabulous connections of our neural networks throughout our brain, where different neurons connect in with other neurons, and these synapses need to be kind of remodeled and pruned, and dysfunctional neurons and neural networks need to be cleared away. The cell that does all that powerful work is the microglia. They support new neural growth. They remyelinate neural networks to keep them kind of signaling very fast, to keep your thinking fast and sharp. And they support healthy blood vessels and blood circulation throughout the brain. Okay, so they are part of the solution. However, these are the cells that can get stuck in a reactive inflammatory state. And instead of being gardeners that are pruning the synapses, they turn into zombie gardeners that excessively eliminate connections between two neurons. They kill neurons, they damage the tissue with their incredibly high level of inflammatory cytokines. And when you've got neurons and synapses being destroyed, your brain function is impacted. You don't think as well. There are emotional impacts. You can get anxious, depressed. You can get OCD, obsessive compulsive disorder. As the protein debris of this destruction accumulates, this is the condition that we see in neurodegenerative conditions like Alzheimer's and Parkinson's. As the coding that runs through a neural network is impacted, the myelination, you can that is one of the layers in multiple sclerosis and ALS. Okay? So you can have happy microglia that are part of the solution and reactive inflammatory microglia that are damaging things in your brain. But they are not the only inflammers in the brain. There are 5 different types of macrophage that do not live in the body. They live outside of the brain, but in the head, still connected to their sisters of the microglia. And when they inflame the microglia. So our brain is encased in cerebrospinal fluid, and there's cerebrospinal fluid vesicles within the brain. And around this whole system, there are macrophage that support the cerebrospinal system. The layer of protective tissue that protects the brain right underneath the skull, the meninges, if this is your skull here, you've got all these different layers of protective tissue before you get into your brain in this cross section right here. That's the meninges. This is the part of the brain that gets impacted when there is a concussion or other head trauma. and there are macrophage here to repair that damage. And then all throughout the brain, there's blood vessels. There's a blood-brain barrier that protects them. And as part of that blood-brain barrier, outside of the brain is a fifth type of macrophage. So you have all of these potential inflaming cells in the head right next to the brain as well. So how do the microglia and these brain macrophage get triggered into a state where they are inflaming and causing brain fog? It's basically all the same reasons we saw that cause brain fog earlier. Concussion, any type of head injury, emotional traumas, especially from earlier life, are predisposing. Infections in the body, infections in the brain, inflammation in the body, and toxins. So the same set of triggers here, the same stories behind this inflammation. Okay, so that's the issue. What can we do about it? So I've been researching the science on brain inflammation and applying the tools of body intuitive mind-body medicine to address this. I've developed a way to do intuitive scans to look at the intensity of the brain flames. Okay, since stress is connected to inflammation, you can work the stress angle, you can work at inflammation in the body, inflammation in the brain. It often involves building up somebody's energy or chi reserves so that they can actually do the healing work that the session invites. And in many cases, this inflammation is due to COVID. So I've certainly specialized along with Dr. Janet in the past few years on post-COVID symptoms that include brain fog, inflammation, and other things. And that is the data that I want to walk you through right now. So this is a case study that we just completed. Janet and I did not do any of these sessions, but a set of 20 practitioners that we were training in our latest methods did this work under our coaching. We worked with 34 people that either had some serious post-COVID impacts or a full-on diagnosis with long COVID. 31 of them had PCR verification of their infection. Some of them had had COVID once, some of them multiple times, mostly women. A wide range of age from age 22 to 75. And we looked at 14 different common symptoms that people have post-COVID, one of which is brain fog. And on average, these 34 people had 8 symptoms that they didn't have before they had COVID-19. Okay, the practitioners in this program were, some of them were certified just out of our basic intro classes. Some of them have been doing this for a very long time and were our master practitioners. So quite a range of levels. And all of the participants got at least 6 sessions. Some of them got a few more, working over 2 to 3 months in general. All right, so we looked at these 14 symptoms: respiratory symptoms, tiredness, fatigue, fever, pain, headache, brain fog, dizziness, heart palpitations, that fast beating heart, digestive issues, impairment in taste or smell, and mood changes, and menstrual cycle disruption, and skin rash. So in order to assess whether there was any improvement with the treatments, The study participants told us how they were doing. These are called self-reporting surveys. They're filled out online, and they report their symptom severity before they began the study, at the beginning, in the middle of the session series, and then a week or so after they had their final treatment. They rank them in terms of no symptoms is a 0, extreme symptoms is a 5, mild is a 1. Okay, so I'm going to just give you the big picture first. These are the overall results. So almost 60% of the people had excellent progress, which means that over 80 to 100% of their symptoms improved. If we combine the excellent, very good, and good categories, good is at least half of your symptoms improved. 88% had good to excellent results in terms of improving their post-COVID symptoms. Okay, so that is excellent results. And now I want to show you a snapshot of an individual so you can see what this looks like for a specific person. This is a woman that had had COVID twice. She had 12 post-COVID symptoms. 8 of them, all the ones that have the stars, completely resolved by the end of the treatment series. Okay, and 4 improved. So she had got progress on all 12 of her symptoms. Smell and taste, mood changes, dizziness, headache, heart palpitations, fever, cough, and breathing completely resolved. You can see the improvement here in her brain fog and her pain and her digestive issues and her fatigue. So again, this is a snapshot of what it looks like from an individual perspective. Now, since brain fog is the topic of our seminar today, what if we look across all 29 people, so 29 of the 34 case studies had brain fog. This whole group here listed their brain fog as extreme at the beginning. This is the moderately high, moderate, and then down to mild here. Okay, so 86% of these 29 people, 25 of them, their brain fog got better. Okay, in a small percentage, 4 of them, the one was the stars, their brain fog completely resolved. But if we look across everybody here, if there was improvement, if you took at the amount of brain fog at the beginning and the amount at the end, how much improvement did we see on average in an individual? 60% improvement in brain fog. And we know that 6 session is not really adequate to completely resolve this issue, but that is very nice progress for 6 sessions. All right, so I've just shown you that 86% of those with brain fog improved. If we look at some of the other top symptoms in people that have post-COVID issues, of the 27 with pain, 89% improved, 30% their pain completely went away. Let's look down here at taste and smell. 12 of our case studies had that issue, 75% improved, 60% completely resolved over the session series. Let's compare this rate, 67% complete resolution of impairment of taste and smell, as compared to 7% for the deadly fatigue that can happen post-COVID. This is the incredible chi depletion of this viral condition. So we got, again, mid-70s% had improvement in their fatigue, but complete resolution in a smaller percentage. this definitely takes more sessions than healing impacts in taste and smell. All right, so this is now looking at across all the symptoms. This is the number of people that had each symptom. Brain fog is in the middle. Okay, this is the average improvement. Okay, if we look at how much improvement everyone that had dizziness, 76% improvement. So, almost all the brain fog resolved. Fatigue is at the other end of the spectrum. 41% improvement in fatigue. A few of them had their fatigue resolved. Okay, and then most every symptom that we looked at was about 60% improved. So our clinical research specialist helped us with this case study design and analysis, and she looks at the impact of different types of drug trials and their average percent improved. And if they're getting 10 to 20% improvement in a drug trial, that is excellent improvement. So with an average up here around 60% for most of these symptoms with this series of mind-body medicine treatments, this is looking fantastic. So were there any control groups? This is a case study. It is not a case control research study. So that means each person is consented. They know that they're part of this case study program, but there isn't a control group in a case study, okay? Which means that we can't publish it, but we can talk about it. All right. So, and then this is the improvement across all 14 symptoms. This is the percentage of the people that improved. So you can see 67% with rash, up to 89% with pain. The percentage of the people that had that symptom improved. And then you can see the differing heights of the dark green bars. That's the percent that had their symptom completely resolved. So some of these symptoms resolve more quickly and effectively with mind-body medicine treatments like dizziness and taste and smell resolve more quickly than fatigue. Okay, and here is brain fog right here. I'm just going to take you through the conclusions here. So in this mind-body medicine case study program for body intuitive and recovery from COVID and brain fog, we got excellent results. Most of the participants improved, and they got about 60% improvement on average in all 14 symptoms. So there was no symptom that didn't show improvement. Okay, some symptoms, as I said, resolved more quickly. Fatigue was the slowest to resolve, and dizziness the fastest. Okay. And we got what I call mind and body results. So we were looking at 13 physical body symptoms like pain and brain fog. And we also looked at mood changes, and we saw improvement in both dimensions. Okay. And the important thing to me, since there are now only a handful of people, maybe 50 people that have been trained to do this, 50 amazing practitioners, is that we can train people to get these types of results. Every single one of the participating practitioners got successful results in their with their case study participants, even if they had just been doing this for about 9 months, had started the training program and gone all the way through the advanced classes to be able to do this. So this is very encouraging to me. Now I would like to demonstrate how this works. I sent a survey out to those of you and asked who had brain fog and who would be up to um, kind of be my demo candidate today. And I found two women that said yes. I found a handful of people that said yes. Okay, I haven't met either of these women, so they are new to me. I am just going to bring up your intake here, and then maybe you can elaborate a little bit here. So you told me on the intake that your brain fog, if you were to rank it on a 0 to 5 scale, where 0 is none and 5 is extreme, that it's a 4. Is that
Hmm.
correct?
Yeah, I think so.
Okay. And does it go up and down, or is there like a bad time of day or?
Probably, yeah, I'd say it goes up and down. Maybe more so in the afternoons or in the evenings, just when I'm
Okay.
generally more tired.
Okay. And then I asked you about different kind of things that you might be challenged by. And first, why do I ask this question? Then you can elaborate on anything that you'd like to hear. Depending on what people are, where their challenges are, it tells me where in the brain the inflammation might be. So it hones my intuition so that I can be precise. So I asked you about how's your focus and your ability to concentrate, how's your memory, language and word recall, and thinking. Some people tell me that their thinking is like slower than it used to be. So what would you like to share here?
Um, yes, the thinking is definitely slower. I just feel like it takes me longer to maybe make connections, or when my husband or kids will tell me something, I feel like sometimes I'm like in a jar of honey, just trying to kind of put things together. The memory thing is definitely a big one. Just generally, I mean, I'll go to the next room and then completely forget what I went for. Um, or I'll forget to turn off the stove. Just there's a lot of things that happen sort of on a daily basis, numerous times a day, where I'm just forgetting stuff like that. Or
Okay.
I'll just sometimes mid-sentence, or mid-paragraph, like I'll be having a conversation and I'll have all of the things that I want to say, which normally I could have like had 5 things and then very precisely outlined them all. And sometimes mid-conversation, I will literally just forget the topic. And I'll just say, I'm so sorry. I don't even know what I was about to say.
That sounds very frustrating.
Yeah, it's really different. Yeah, I'm not used to that, so it is a little bit frustrating.
Okay. And you said when I asked you how long you'd had brain fog, you said you had a concussion 6 years ago, and that's kind of when it started. But since you've had COVID a couple times in the
Mhm.
last few years, it's gotten worse.
Yeah, yeah, I've had COVID probably, I think I had it once at the end of 2019, kind of right in the beginning of everything, and then I think the next one is probably 2021, although I can't remember exactly, but I do remember after that one, it just took a long time to recover, maybe a couple of weeks of just like extreme fatigue and just the brain fog, which I just hadn't really felt before to that extent. So I felt like that one was like it was a kind of a big shift. The concussion
Okay.
was a big one. And then I don't remember feeling anything during after the first COVID, but the second COVID was definitely just had a really different kind of a feeling to it that I hadn't felt
Mhm.
before.
And did you have any other symptoms with the COVID and any that are still with you? Like, is your energy back? Was your digestion impacted? Your cycle? Any other
The
symptoms?
Yeah, the sense of smell, that was definitely impacted. And for a long time, I felt like it wasn't back to normal, and maybe it's still not. I've always had a really, really acute sense of smell. And since then, I feel like it's a little bit decreased. Yeah, a lot of others, dizziness, headaches. I mean, that could be unrelated, I'm not sure. What else? Nothing really respiratory, some digestive stuff, but again, there's living in Costa Rica comes with its own set of digestive kind of things. So I'm not sure what to attribute to the, COVID or just general life for the last couple of
Mhm.
years. Maybe, yeah, I think mostly cognitive
Okay.
stuff.
And do
Yeah,
you still have the dizziness or the headaches?
I definitely have the headaches. Yep.
Okay.
Some dizziness also. Yeah.
Okay. And all of those, as you might imagine, can also be connected to that elevated inflammation in the brain. So they're
Mhm.
kind of part of that whole set of symptoms. So it's like
Yeah.
you solve, they can be solved at the same time.
Great.
Yeah.
Great. Yeah. A little bit
Okay.
of emotional maybe too, like a bit of anxiety that has come up too, which is also a little bit different from before. So maybe that's part of it too.
And that's very common. Okay.
Mhm.
uh, that there's anxiety or depression or some other psychological or psychiatric symptom that you've never had that shows up as part of this. Um, so I scanned beforehand. So I'm just going to kind of describe what I scan. And then I'm going to take us through the results that I found for you and then do your session. So I do what I call a brain flame scan, and I'm looking at what's going on behind the brain fog symptoms. And this is also going to be the headaches, the anxiety, the dizziness. It's basically what's going on between that whole spectrum of symptoms. I get the flame intensity on a scale of 1 to 10. 2 is background. You got to have a little bit of inflammation to be effectively healing and resolving things. So 2, if it's all 2, then there's no inflammation to speak of in the brain. I look at what cells of all the different types of cells that can inflame in and around the brain, see where the flames are. And then I look at what areas of the brain or what whole network functions in the brain are impacted by the inflammation. I unpack why is the inflammation up? So what has happened on all those? Why do people get brain fog? Kind of that list of things. And then how are we going to address this? How can we resolve it? Okay, so that's what I looked at. I am going to, let me see. I don't think I can hide this at the moment. Via, are you up for me comparing and contrasting your scan with Jennifer's here? You can just chat in. I'm going to do your session in a moment. Yes. Okay. Because this is an interesting comparison. So the first thing that I looked at is what I call the bandwidth. That is, how much healing energy do you have? That tells me how much of a session I can do and how much of the deep epigenetic repairs behind the brain fog can I do in a single session. So Jennifer, you have a pretty good bandwidth today, which is 5 on a scale of 1 to 10, which means that I'm going to start to unpack your brain fog. I'm going to do the epigenetic repairs. Um, for Vaya, we're going to do the pre-work to get her ready for that because her bandwidth is a little lower. She has still more fatigue. Okay. Then I look at the toxicity in the body or the brain. This is a concept in science called toxin burden, which is our burden of environmental toxins. So 3 is the best that a modern human can have for the most part. So you both have very low toxicity in the body. Your toxicity is nice and low in the brain. Your blood-brain barrier looks very good. So there is no weakness in the blood-brain barrier because um, brain inflammation and COVID and concussions can all impact the integrity of the blood-brain barrier, but I don't see any impacts for you. There is one impacted area for client V, and therefore her blood-brain barrier is leaky to toxins, and there's high toxicity in the brain. So this right here is a problem to solve. The weakest chi for you, Jennifer, is your digestive chi, your gu chi, which tells me where I'm going to work. And then what is the level of brain flames in the various inflaming cells? Remember, 2 is background, so the astrocytes aren't inflaming. The microglia are 4. That is a very common post-COVID or post-concussion brain fog level. When you have brain flames at 4, in my experience, there's brain fog. You also have the macrophage that are right under the skull in the outermost layer of the meninges are a little flamey. Not too bad, but this is the residual concussion impact. Okay, and we can compare this to higher inflammation here for client V, a different macrophage, the macrophage around the blood vessels here are inflamed. Okay, and if I look at the number of genes that are locked into a higher state of inflammation, for you, Jennifer, it's 4. 3 of them from the 2 cases of COVID, and 1 from the prior concussion, and one of your brain networks is impacted, which is the network that is called the central executive network. The central executive network is the network that controls all the brain networks. So when that network is impacted, there can be many, many impaired functions. So this is a really important network inflammation to resolve because a lot of your trouble concentrating, language, remembering things, a lot of that can get better just by addressing one network. Okay, and if we look over here, a couple more marked genes. In this case, 1 inherited, 3 from COVID, 2 from toxins that got in the brain. And we can see that there are high toxins in the brain and more brain networks are impacted. Okay, so that is my intuitive assessment. It tells me where to focus. And now I'm going to dive in and give you a session. Do you have any questions on your scan, Jennifer?
I don't think so.
Okay. And how did I get these numbers? I'll talk about that in a minute. So I'm going to, some of you do this all day, every day, and you know what I'm doing, and other people have never seen a session before. So I'm going to explain it as I would to a first-time client. So the first thing that I do is I get quiet and I get centered. I take a few breaths and I just release any distractions. I connect into my intuition. And now I'm going to set up a muscle testing to be able to read information from my remote client here, Jennifer. So I'm going to set up a yes and a no muscle testing. And we are going to dive in. And Jennifer would like to start. We're just going to go for all of the epigenetics because that is a very quick win. So we are going to go for what I call the first layer that is locked in. It is a brain fog marked gene. It's marked because there's chemical tags on it that are locking it into a configuration. It is from COVID-19. So why is this gene marked and not functioning optimally? Because it is a leftover from COVID. Okay, and this is the second COVID in. You thought it was about 2021. Okay, so what type of cell has this epigenetic? This is an epigenetic error. Okay, we're going to be fixing that error. So I'm just asking with my muscle testing. This is in the microglia. Okay, microglia are everywhere in the brain, so that's too big a place. So we're going to dive in and figure out microglia where. It is microglia impacting, again, this central executive network, which is, you can imagine, if your brain had an executive that controlled everything, that we're right in kind of the executive's office here. And there are 3 or 4 areas in this network that are impacted by the microglia inflammation. Okay, 3 areas in the right hemisphere and 4 areas in the left hemisphere. That's what I mean by 3 to 4 areas. I don't need to know the names of those areas because I've identified a whole functional network that is impacted. Okay, and the type of inflammation is there is one, I call it the COVID chemokine. It is an inflammatory communicator that is a hallmark post-COVID, which means you can measure it in a blood test. It is very commonly stuck on high after COVID-19. So in the microglia, they are cranking out way too much of this inflammatory communicator. Okay. And in terms of a strategy to heal this, when there's a lot of inflammation, just imagine a forest fire. If there's a forest fire, things get very dry. And so we need to optimize the hydration in this area of the brain. So we are going to organize and optimize hydration in the central executive network. Okay. In order to, as part of the healing strategy here. Okay, so that is the first thing that we are going to do. And what are we going to do next? So next, this is basically the first one of 4. We have 4 of these epigenetic layers. And now we are going to go work with your digestive qi. Okay, in Chinese medicine, this is the gu qi. And this is, as I said, your weakest qi. And there are a few kind of whys here. Why is it weak? One is there is a food in Costa Rica that basically your digestive system hates. Um, I don't think it's something that you eat now, but it could have been something that you ate for a while. Is there anything that you feel like you used to eat that you developed an intolerance to?
Not that I can think of. I wish there was, but I can't really think of anything.
Okay, it's a vegetable. Are there any new vegetables that you started? How long have you been in Costa Rica?
Just over 2 years.
Okay.
Um, I mean, I eat sort of all the same normal vegetables, all the salad stuff, all the cauliflower, broccoli, kale, bok choy, green beans, all that kind of normal stuff.
Okay. It's not bok choy, it's the Costa Rica bok choy. Okay.
Costa
Because,
Rica. Okay.
there's different things in the
Yeah.
soil and different microbes. So something about that bok choy is depleting um, for your digestive system. So until it gets boosted or repaired, taking a bok choy vacation would be optimal.
I don't eat much of it, or it could be yuca also. I'm not sure.
It's not the yucca. And even if you don't eat much of it,
Mhm.
it can um, impact the gut microbiome in a way that impacts digestion, even when you're not eating bok choy. And
Okay.
that's what I'm seeing for you. So there
Mhm.
was a hit from COVID, there's a hit from something in the bok choy.
There
Um,
could also be a hit from parasites, just saying, because I think that's been going on for a couple of months. I've been dealing with it, but maybe if that's something too.
I'm not seeing that. I'm
Okay.
not seeing that. We are going to go next. We are going to go to your gut microbiome, and we are going to go to the microbiome in the first part of the colon. And there is a fungal overgrowth and imbalance there. And this is again from the bok choy. I love bok choy.
Me too.
And we are going to bring in a healing strategy for the whole session. It is going to help with the repair of the microglia, calming down their inflammation. It's going to help boost your weakest type of chi and repair the impact on the microbiome. And it is going to be one of our resets. Do you know the earth element reset?
I don't think I've done that, no.
Okay, so I'm going to send you a little video so that you have that. It's like a little 5 minute um, um, it's mindfulness, acupressure, um, tapping, and focus. It's a little healing tool that takes about 5 minutes a day. And it's going to be part of essentially, it's going to drive the healing of your session. And it's going to be great to do for about 2 weeks. If you miss a day, don't worry about it, but it's kind of a once a day sort of practice. It's like a little mini meditation.
Great, thank
Okay.
you.
There's going to be acupoints to tap. I am going to add in another piece here. I'm going to do another epigenetic air behind the brain fog, because if I can do half of the story in one session, most people really notice that. Okay, we're going to do the second of the 4 layers. This why why is this here, is from the concussion. So this is the prior impact. And this, if we look at what cell type it is in the immune cells just under the skull that are impacted and heal the brain and the brain protective layers in a concussion. So it's the macrophage in the outer meninges, in the dura mater, okay? Okay. And where was the concussion?
I fell on the ice and hit the back of my head on the ice.
And more in the center, right, left?
I think the center.
Okay. Okay, I'm seeing that it's a little more on the right side. Some on the left side, more on the right side. Okay.
Mhm.
All right, you're going to see I'm going to ask these same questions that I asked above. Okay. I know where. What is the type of inflammation that these macrophage are overproducing? No. And it is an inflammatory cytokine that macrophage make called IL-6. And they are overproducing that cytokine. Okay, and the trigger for that was the concussion. And around the time of the concussion, were there any big stressors or emotional things going on or anything that the concussion itself triggered?
Um, I don't remember. Yeah, I don't remember. I mean, it was scary. I do remember that. And I think around that same time I got hit with a car, rear-ended, and then I got whiplash, which I feel kind of also like it was the same kind of jarring motion. So I remember that. And yeah, I think it kind of triggered some fear. And but I don't remember any particular events around that time.
Well, having your brain impacted in 2 accidents, that's enough for
Yeah,
some
right.
fear. I was seeing a little bit of emotional impact here. So we're also going to do an emotional kind of resolution technique to clear the fear. Okay, we're going to clear the inflammation, but part of the reason, 6 years later, why have these macrophages still screaming? It's not because they couldn't have fixed this. It's that something about the fear is part of how they got stuck in this higher inflammation state. Okay. Okay. So I'm going to guide you through something to tune into and clear the fear there. But if you think back to the fear, what would the intensity of that be on a scale of 1 to 10, where 10 is most intense?
Well, it's funny, the concussion, when I talked about the accident, that brings up more fear.
Okay.
I don't know if that,
Then think of the accident. Yeah.
yeah, maybe like a 8.
Okay. All right. That's kind of what I was seeing. Enough fear that it impacted the healing. So how long after the concussion was the accident and the whiplash?
That I don't remember.
Like, okay. But
Yeah, I actually, yeah, I really, I don't know, the last 6 years have been a blur. So.
they were close enough in time, I'm going to
Yeah,
say, I'm talking to the macrophage here, that they weren't done clearing the concussion when this accident happened. Okay. I am gonna look at where in the brain. Um, it is kind of in a stripe back here.
okay.
The uh, basically a head impact impacts the immune cells under the skull in that zone. And that's what I'm seeing. It's like you've got a bar of inflammation back here, and then a whole host of brain areas in the central executive network that are kind of lit up here. Okay, so this is good for the session. And how do I know that? Because I ask if there's any more and I get, no, we've got it. So we're doing 2 of the 4 layers that are kind of locking in the inflammation and the brain fog. And this is somehow woven into a weakness in your digestive chi. Part of that is from the COVID, and part of that is um, a vegetable that has thrown off your microbiome and therefore is weakening the digestive chi. Okay. And so this is, it doesn't need to be never having bok choy. It's like taking a bok choy vacation for about a month. Okay. So now I'm going to activate the session. We just determined the kind of what needs to be healed and resolved. Now I'm going to remotely activate the session. What I'm going to ask you to do is to focus on the accident. Okay, maybe it was during the accident, maybe it was post-accident. You want to find the area where the fear is most intense and just kind of shut your eyes, wander back and find the emotional intensity. Have you done the sweeping breath? Do you know that technique, or you want me to explain it?
I've done it.
Okay, so that's what I'm going to have you do. You're going to inhale as you sweep to the left, tuning into the fear at that time. And then you're going to exhale as you sweep back to the right, releasing the fear. So I'm going to have you do that. And what am I going to do? I'm going to tune into all these brain areas. So Jennifer is just going to keep sweeping away her fear. I'm tuning into all these brain areas in this powerful executive control network in the brain. They're still stuck in a active COVID infection state, and this is going to be their cue to kind of stand down. Now I'm going to go back to this area that hadn't completely healed from falling on the ice when the accident happened, and this healing got stuck. Now I'm going to remotely do the earth element reset. So I'm going to be holding the digestive area, bringing in the focus to digest, nourish, and energize. Bring in some clear thinking as we repair these brain networks. And I'm going to tap a set of acupoints to get this healing activated. Whenever you feel that intensity calm down, Jennifer, you can go ahead and go breathe back in your energy that is trapped back in time in this era of the double accidents, falling on the ice, getting the concussion, not too long afterwards, getting in this car accident. Okay, now I'm going, you see me tapping in space. I'm looking at my remote client here and I'm activating several zones of high, powerful acupoints to get this running through her whole energetic system. All right, and now I'm going to ask you, were you able to identify that fear and what is the intensity now?
Yes, I was able to identify it. And I feel like it's dissipated.
Okay,
I feel like it's still dissipating.
okay. Okay, so still dissipating, but down from an 8.
Yeah, like a 3.
Yeah. Okay, good. So we want to see that it's lower. It doesn't need to be at a 0 because it's going to be processing.
I
So
feel
the
like
healing strategy, someone asked a question for the whole session, is the earth element reset. It's working with both of the brain fog epigenetic errors, one from COVID, one from the concussion and car accident, and it's supporting the gut microbiome and the digestion. And the session, we kind of observed it and activated it here right now, but it is going to be actively healing behind the scenes for about 2 weeks. And I'm going to check in with Jennifer and follow up with her so that we can do all 4 of these brain fog epigenetic errors and then check in and see how that brain fog is doing. So, questions, Jennifer?
I don't think so.
Okay.
So thank you so much. Yeah.
Yeah, thank you.
Yeah.
So I will be sending this to you and giving you some guidance on what to do. But I would probably, if you notice that you're more thirsty, drink more water.
Okay. Okay, perfect. And I feel like it's going down more now too, like it's at a 2. I just feel like
Okay.
there's a lot of stuff that's processing. So it's
There's a lot of stuff that's processing. Yes.
yeah, yeah.
Yes. All right. Thank you so much.
Thank you so much. I appreciate it.
I got very enthusiastic with how much data I wanted to pack in today. But what I was hoping to illustrate for all of you today is that brain fog can be resolved. I showed you the case study data that suggests that we're making progress, and I demonstrated a session so you can see how I do this. These microglia calm down out of their zombie state where they are destroying neurons and synaptic connections, and they become neuron and synapse healers instead. They clean up all the collateral damage of the inflammation. And the strategies of mind body medicine are really supporting people with brain fog, helping them get their memory back, improve their thinking, calming anxiety and depression, balancing overall mood, and improving their energy. And brain fog is a bigger category. It also supports people as they get older with any type of memory impairment here. So there's many applications of the work that I took you through. If you are interested in more information on anything that I presented, you can find me at mindbodyscience.com or on Instagram at Dr. Laura Mindbody. If you would like me to connect you with a body intuitive practitioner that can help you resolve your brain fog or the brain fog of someone you know, I'm happy to do that if you just connect with me. Um, and if you want to learn how to do this and you're somewhere along that journey or ready to begin this journey, I can support you with what your next step in that process is. Again, just contact me. So my practice is full, but we've trained these amazing practitioners to support you in recovery. And I'm happy to answer any questions. And I want to thank you for joining me today. I'm coming back in a month for the next chapter in Discover Mind Body Medicine, and I'm going to be more brief on October 1st. So I hope you can join me and invite a friend if you're interested.